Good evening. As we come on air tonight, the Mayor, the Emergency Services and Transport for London are meeting to discuss a plan of action should there be an outbreak of the coronavirus in the capital. In the last 48 hours, 6 cases of the virus have been confirmed in London and the home counties. One case, a clinician working at a cancer treatment centre in Northwood. Well, that clinic has remained open, but Wimbledon College in Merton, where a member of staff tested positive, has shut its doors until later in the month. Sadiq Khan has again told people not to panic, but that he was in regular contact with Public Health England for advice and on how to monitor the impact on our city. With the latest, here's our political correspondent, Simon Harris.
Schools and doctors' surgeries have been touched by coronavirus, now a hospital. Mount Vernon Cancer Centre at Northwood treats 5,000 new patients every year. Today, the local NHS trust revealed a member of the medical team had tested positive. The infected health worker was described as a clinician, which usually means someone who treats patients. The hospital said everyone who came into contact with the clinician had been traced. But hospital managers insisted the risk to patients was very low. The cancer centre was open, with patients and visitors advised to turn up as normal.
Every patient checking in is being given a piece of paper which states about the virus having been here and where it was or where it wasn't in the hospital.
You know, you just got to sort of go with it, haven't you, and trust that they've made all the right precautions or taken the right precautions.
There are believed to be half a dozen confirmed cases in London and the home counties. On Friday, 2 people from Hazelmere in Surrey tested positive. They're in St Thomas's Hospital in London. Last night, a patient was admitted to Princess Alexandra Hospital at Harlow in Essex. This morning, we learnt of the case linked to Mount Vernon at Northwood in Hillingdon and a member of staff at a school at Wimbledon in Merton. This afternoon, another case was reported at Harpenden in Hertfordshire, where the NHS has been contacting patients who used a medical centre.
What we know is that with this virus, the vast majority of people will make a full recovery. The vast majority of people will have a mild illness. Children and otherwise healthy adults seem to be at low risk of getting complications from it.
In Whitehall, senior ministers joined Boris Johnson for an emergency Cobra meeting, but London's mayor wasn't invited. He described that as a bit odd.
I think this is one example where we should put aside petty party political difference and work together. I'm just really sorry that Number 10 hasn't seen fit to behave like adults, like we are.
At Wimbledon College, pupils were told not to turn up for another 10 days after a member of staff picked up the virus on a trip to Italy. Staff room colleagues were advised to self-isolate, so the school doesn't have enough teachers. A patient who turned up for an appointment at Davenport House Doctors' Surgery in Harpenden was also found to be infected. The surgery was open today after a deep clean.
Well, Simon, we mentioned earlier that the Mayor is having that meeting right now with TfL and the Emergency Services. What else has he had to say today?
Well, the Mayor may have been frozen out of the government's Cobra meeting, but this afternoon he's been holding his own mini Cobra at City Hall. Sitting around the table with him are representatives of the London boroughs, the NHS, Transport for London and the London Fire Brigade, as well as the Met Commissioner. And the plan for the meeting is to come up with whatever preparations are needed if the virus spreads. And the Mayor, for one, says he has given up shaking hands with people.
Well, listen, there's nothing against shaking people's hands. I'm now not shaking hands because we've got to be prepared. The advice I've received from medical experts is if you look around the world, people aren't shaking hands just to be prepared. At the moment, there's no reason why you shouldn't shake hands. The key thing is if you do, just wash your hands afterwards. There's nothing against the person you shake the hands with, but it avoids having to wash your hands regularly.
We haven't heard from the meeting yet, but the Mayor says whatever advice he's given, he'll pass on to Londoners. Meanwhile, the government will publish its coronavirus battle plan tomorrow.
All right, Simon, thank you. On to the day's other news now, and Sadiq Khan unveiled the pledges he hopes will win him re-election to City Hall in just a few months' time. His focus is on rent control and making the capital more affordable for people to live in by limiting the amount landlords can charge tenants. But it's a promise he currently has no power to deliver, as our political correspondent Simon Harris reports.
I'm making the mayoral election on the 7th of May a referendum on this issue.
Sadiq Khan's campaign message had echoes of 4 years ago.
This election is a referendum on the Tory housing crisis.
Then he was promising to build thousands of new homes. Today he was demanding the right to tell private landlords how much rent they can charge. But as Mayor of London, it's not in his gift. Do you accept you don't have the power to bring in rent controls?
There are many areas I've not got the power of. We've managed to persuade the government to do things.
So why are you putting it in your manifesto if you don't have the power?
Because there are examples where we've managed to persuade the government to do stuff. You've got to be ambitious. Like, give me some examples where we've been ambitious and succeeded in the last 4 years. People said to me, why are you lobbying the government to say change the borrowing limits so councils can build new homes? You don't have the power to do so. We lobbied. The government's changed the rules and now councils can borrow to build. So we've got to be ambitious. We've got to be the Mayoral of London. Don't just be a sycophant.
There's a difference between lobbying the government and basically an ultimatum.
One of the things that we know from the Prime Minister is he says that he respects the democratic will of the people. So what I'm saying to Londoners is if you vote for me and I win big, I'll have a mandate to say to the government, now that I've won and I've won big, you can't really ignore the democratic will of the people.
Do you accept you can't bring in rent controls without the government's help?
Oh, absolutely. There's lots of things I can't do without the government's support. I'll give you one example.
So can I just say then, this is rather like you saying that you're going to make London carbon neutral by 2030. You can't do that without the government. You're peddling policies that you don't have the power to bring in.
Let me deal with that. Look, people said that as mayor, I couldn't build a record number of genuinely affordable homes. Well, last year we began more council homes than any year since 1984.
You said your policy on rent controls is going to make this election a referendum on rent controls. Is that to avoid it being a referendum on your failure to stop young people being killed, your failure to bring Crossrail in, your failure to deliver enough houses?
Well, it's first to do with violent crime. It's really important when we begin this conversation, we remember all those bereaved families who have lost a loved one because of violent crime. These are preventable deaths. It's really distressing. In relation to violent crime, I'm quite clear, and that will also be a central issue of this campaign as well, by the way, is serious youth violence began going up in 2012. That's the evidence, 2012.
Sadiq Khan knows it's his record as well as his wish list, which he'll need to sell to London voters. Simon Harris, ITV News, Hackney.
Good evening. As the spread of the coronavirus continues, we now know for the first time how many cases there are in the capital. Well, earlier, Public Health England confirmed 25 people have tested positive for COVID-19. 2 of those are patients at King's College Hospital. Well, the hospital says it is taking every precaution and adhering to strict protocols to stop any spread. But the MP for the area, Harriet Harman, said more information is needed from the hospital in real time to help patients and their relatives who are worried. Our correspondent Simon Harris has the latest.
It's one of London's major hospitals. King's in Camberwell boasts almost 1,000 beds and serves a huge population of South London. With so many staff, patients and visitors, there was always a chance someone here might have come into contact with the virus. Now it's emerged 2 recent patients have tested positive for COVID-19. The immediate priority, apart from treating the 2 infected patients, was to stop the virus spreading. King said strict protocols were in place, but gave few details. A brief statement said the measures included restricting access for staff and visitors to the ward. The local MP said people needed more information.
Patients who are due for appointments this morning, should they go in or not? Visitors, would they be turned away if they went to visit their friends and relatives? And GPs, should they be referring? Now, until the point at which I came into this chamber, there was nothing on King's website to say what the situation is.
At Canary Wharf, the entire floor in a 45-storey skyscraper was being cleaned and sterilised after someone working for HSBC Bank was diagnosed. Colleagues on the same floor were sent home. And at Finchley in North London, a note on the door of a dental practice told patients a dentist had tested positive after feeling unwell at home. He's thought to have been in Italy recently.
Happy birthday to you.
At Oakfield Prep School in Dulwich, a class of 7 and 8-year-olds dressed up for World Book Day were also getting a lesson in hand washing. They were quick to learn the simple formula: soap, water and singing happy birthday. And they all knew about coronavirus.
People in Italy have it, and there are some people in London who have it.
Lots of people in China have it, and they don't know how it started.
I've been told that washing your hands is very important. It's really the only thing you can do.
The teacher today was Britain's top family doctor. Nikki Kanani is the medical director in charge of GPs at the NHS, and she's a firm believer in soap and water.
Sanitizer gel is really good as well if you can't access hand washing, but hand washing with soap and water is always going to be superior. So don't worry about stocking up on sanitizer gel, just make sure you wash your hands regularly.
We learnt something else today. The government is preparing to move to the next stage of tackling the virus, no longer just trying to contain it. Simon Harris, ITV News, Dulwich.
So Simon, we saw in your report how school children are being taught to wash their hands to stop the spread, but we also found out more information on the number of cases here in London specifically.
Yes, on Monday we were talking about 6 confirmed cases of coronavirus here in London and the home counties. Well, today the government has given precise figures. We now know there are 25 cases in London alone, so that's a 4-fold spike in as many days. There's also been the first reported death of a patient at a hospital in Reading, an older person apparently. Now, the person did have coronavirus, but the hospital also says they had an underlying health condition, which of course may have been responsible.
Right, Simon, thank you.